Ready? Okay. Hi guys, this is Dr. Sam here, okay, and we have Joe. We're gonna go over a little bit of a shoulder assessment for you guys. So when a patient comes in, they have shoulder pain, I always like to get a good history, okay, see if there's some sort of accident or injury that occurred that caused the shoulder pain, or if this just came on insidiously, right? A lot of patients, they come in, they're desk workers, they're sitting in that poor posture position for 8-9 hours a day, okay? And then obviously that can put a lot of strain within your shoulders, right? So if I have an overhead athlete or if I have a desk worker, that kind of changes on how we assess. But today we're just going to go through a general shoulder assessment, show you some tests that I do, and then show you a little bit of treatment as well. So say Joe comes in and he doesn't have any sort of injury history or anything like that. He just comes in, he's sitting at his desk for long hours out of the day, and he just has some tightness within the front of his shoulder, right? First thing that I like to do is take him through some range of motion first. So what I'm going to have Joe do here is just raise his arms all the way up overhead into flexion and see if there's a limiting factor from side to side there. Go ahead and go down. Perfect. I also like to have him go all the way out to the side. We can do this standing or sitting. That's totally fine. Good. And again, just looking to see if there's an imbalance from side to side there. Okay. The next one, go in the field goal post here and go all the way down, checking for internal rotation. Good. And then we're going to go all the way back, checking for external rotation. So just active range of motion here is a good way of seeing if we have any tightness or imbalances within the shoulder itself. And then I like to test for strength. Okay? So say it's the right shoulder that we have the issue with. There are a couple of tests that I like to do. First, just a general deltoid strength test. So arm goes straight out like this. We like to push down here, okay, and nice strong in through there. Now say it was weak here, okay, sometimes that could signify that we have some sort of anterior shoulder problem, or we have that rounding forward of the shoulder in which case we have that joint that goes forward and down, and we can adjust for that, right? So another muscle test that I like to do is thumb down like this, a little pressure into here to test for the supraspinatus or one of the rotator cuff muscles there. Okay, go ahead and bring your arms up like this. Okay, now I'm going to push in here and out here to test for the internal and external rotators of the rotator cuff as well. Okay, everything seems to be pretty strong with that, signifying no tears, no traumas, anything like that. Okay, so let's go back to this one. Arm goes out like this, we press down and we have some weakness, okay? We can already see that he has a little bit of an anterior shoulder carriage in through there, okay? So first thing we can do right off the bat is just adjust that, right? So the way that I like to do this, since the joint is going forward and down, is just to be able to pull up and back. So what I'm going to have Joe do here, bring his arm just like so, bring this down, little pull here, and then a pull back here, okay? Now, a lot of the times, we can retest that right off the bat, and if we made the shift that we need to, we retest and it comes back as strong, that tells me, hey, those muscles that were weak because they were being overstretched from the malposition of the shoulder, okay, now strong means that shoulder's in a correct position. Right? Now obviously when dealing with the shoulder, there's a lot of musculature that is attached to the joint as well, so then we would want to take a look at what we got going on. Depending on what he has, we can do some active release, myofascial release within the shoulder, which is what we'll go ahead and go through next. So go ahead and go on your back for me, Joe. So again, if we have that anterior rolling forward of the shoulder, a lot of the times that creates tightness, stiffness within the pec minor muscle here, right? So what I'm going to show you guys here is just how I release that. I'll just take a thumb and I'll press it right into the front of the shoulder, right where that pec minor attaches. And we'll press down and then we'll bring Joe through full range of motion, just like this. Now this can get a little spicy. We have a lot of nerves that flow in through this area. And so I always tell my patients, tell me if it's too much, right? We don't want to over-aggravate or push so hard that our patients can't relax with this, because ultimately we want to get that full range of motion there. So just like that, okay, And usually I'll do about 10 repetitions of that. Another one that we can do if we have some sort of internal rotation issue within the shoulder. This happens a lot with volleyball players, baseball players, swimmers, anyone who has a lot of internal rotation up and overhead. Is we'll take a look at the muscle called the subscapularis. Okay, so that's the rotator cuff muscle responsible for internal rotation. And the way that we do a release of that is we'll actually go through the armpit onto the front of the scapula there. I have my patients press down into their tummy, and when they do that, that muscle kind of jumps out at me, it fires up, and so I can get a little grip on there. And then I have them raise their arm up overhead, just in that plane there, just for a little myofascial release there. So go ahead and go through another one of those, up and over, just like that, right? Little release in through there. So there's a good one for the front with the pec, okay, as well as for internal rotation through the subscapularis, okay? Go ahead and sit on up for me next, it's that way, okay? The next one would be more so for the teres minor muscle, which is responsible for a lot of external rotation of the shoulder. So what I'm gonna have you do here, Joe, is go ahead and bring your arm here, and then I'm gonna have you raise it all the way up overhead. And as I do, I'm gonna place my thumb right through that teres minor muscle and press down and have them go through that full range there. Keep on going there. Perfect. Just like that, right? So those are 3 muscle releases of the shoulder that we can do, and obviously we can get into some other things as well. I do a lot of therapeutic dry needling for the shoulder, grafting therapy, flossing, which you guys saw in another video. But that's all kind of what I do as far as treatment in the relief stage, right? Trying to get him to feel better. And then always sending patients home with some sort of banded exercise, some sort of shoulder stability exercise that they can do as well, getting on the crossover symmetry, just different things, homework that they can do at home to help stabilize, strengthen the shoulder, because ultimately that's just what is going to provide the most long-term relief there. Okay? So there's a quick little shoulder assessment for you guys. If you have any questions, please reach out.